but she was brash. She was like, we're going to induce. Your water hasn't broke. And I was like, my water broke. And she's like, no, your water hasn't broke. And we're going to induce this baby right now. I mean, that's the way she was talking to me. And you got to understand that I'm already ashamed. I'm already feeling scared. I'm already not knowing what's going to happen. I'm already by myself. I didn't have anybody there. Like, and she wouldn't listen. She wouldn't listen. They had the students there, and they were all taking notes. And I got up off the bed. I left.
You got to go in a room and make people feel like they're the only person in the emergency department. And that's really hard when you have like 35 patients waiting, many of whom are really, really sick.
Give somebody some respect, I guess, because a lot of people, they'll look at you like, oh, look at this guy. He's wearing a bandana. He has long hair. He looks rough. He has some tattoos. He's probably a drug addict. You know what I mean? I've been treated like that in an emergency room in Carlsbad, New Mexico. I was in there. I had like a cyst on my leg. It was this thing that was coming out of my side. And the doctor looked at me and he said, oh, were you skin popping? Did you shoot up? And I was like, I don't even do drugs, man. You know what I mean? I told him I don't even do that. And he just looked at me like I was full of shit, and he cut it out and he left me there. And then I was there just laying there, and then a nurse lady comes in and says, oh, what's going on here?
Some healthcare folks, not all, they'll make assumptions about sort of your dietary habits, your hygiene, and who you are as a person by virtue of like your gender. In my case, I feel like it was my race and my zip code. And so I felt like I was sort of tolerated, but not appreciated or not respected, if that makes sense.
She's like, I told him I had pain here, and he gave me antibiotics, and off he went. And I was so livid because I was like, you had to ask for like 2 questions, you know, and then you would have been able to figure it out. And people make mistakes all the time, but the way she described the interaction with the doctor just made me so upset. It is a diagnosis that you can miss, but it made me think, you know, had I gone with her, and I started going with her after that, I would have been like, I think it could be this and this and that. And I didn't want to be the annoying kind of like medical practitioner person coming in. But he didn't hear her, you know, he didn't listen. He just made an assumption. And I think in medicine, we do that, right? We hear abdominal pain, worst case scenario, most likely diagnosis. I need to just figure those 2 out. And he probably said, she's not going to die tonight. She's safe to go home. The most likely diagnosis is X. Boom, off she goes. But you really want to make that conclusion after you've asked like a few questions